Good morning, one and all. I am Dr. Smaranika from the IAP technical team, welcoming you all to today's interesting and interactive webinar on depression and anxiety. Today, we have with us Dr. Jay, Tanvi, and myself. We will be doing the talk, and today's moderator is going to be Dr. Riddhi Sampath. So I would like to request you all, any questions you have during the talk, please put it in the chat box so that we can take it later after the Q&A. And thank you all for joining us here. We will be starting with Dr. Riddhi. Dr. Riddhi, please take over.
Good morning, all. I'm Dr. Riddhi Sampath from IIP Women's Cell Goa. We welcome all the delegates to our 10th webinar on Master on Psychiatry and Depression and Anxiety, okay, by Dr. Jai Shastri and Tanvi Tanna. Okay, followed by that, we will be having a physical activities. Oh my God. Can you hear me all?
You're audible now.
Hello. Yep. Okay, so I would like to introduce Dr. Jai Shastri. Yeah, it is my honor to introduce Dr. Jai Shastri, who is a consultant psychiatrist by profession in Mumbai since last 25 years. He has his own private clinic in Andheri West. He is an honorary consultant psychiatrist in Navneet Jain Health Center, Ashadan, and Sairam Autism Center, Motibai Thakursi Institute of Research in the field of mental retardation. He is a member of Board of Management for the Research Society for the Care and Treatment and Training for Children in Need of Special Care, Mumbai. He is a convener of Child Psychiatry and Adolescent Psychiatry professor in Sir Kikabai Premchand MND College of Special Education, University of Mumbai. Thank you. I would like Dr. Jai Shastri to take over.
Okay, let me start my screen share. A very good morning to everybody, and a big thanks to Indian Association of Physiotherapy. Also, a big thanks to uh, Miss Riddhi and Miss Das for organizing this wonderful activity. I hope I am audible to everybody and everybody is able to see my screen.
Yes.
Thank you so much. So basically, what we are going to do in next around 50 to 60 minutes is to talk about mental health. And I cannot emphasize enough how important mental health is in today's day and time, especially when we are going through the toughest phase of our lifetime. Hope so, we don't face this kind of scenario ever again. The pandemic and the related issues has definitely challenged our mental health to the core and has tasted one and all. But then the awareness about mental health, is it really there? Is it really good enough for all of us to take a note of it or do something about it? Well, at least we understand that the scenario is changing over a period of time. There has been a lot of issues in the past, and a lot of challenges still exist. We need to work towards it, and I really appreciate the efforts of Indian Association of Physiotherapy to making this particular activity on Sunday morning with a reasonably good attendees to do their share in creating awareness about mental health and talking about it. Well, mental health has been a core of overall healthcare system, and that's been acknowledged by even WHO. Let me just try and see. So WHO has recognized mental health as one of the very important component of health. Just a second. And typically people describe or regard health as an absence of disease, or not having any particular illness or ailment. But that is not how we should look health as. And there are various aspects to health which is equally important, and one should be taking care of it. The other aspects which has been spoken by is the physical health, spiritual health, social health, and along with it, one of the most important part has been the mental health. So mental health has been in the core of overall health system for a reasonably good period of time, recognized by WHO, and that forms the awareness about mental health, the uh, the overall stability of mental health forms the core of the complete health of human beings. So that's something which is very, very important. And to understand the seriousness of mental health, every year on 10th of October, we celebrate the Mental Health Day, World Mental Health Day, as we did yesterday. There were over 1,000 plus programs, even in the era of pandemic, were conducted all over India. And mainly to create awareness about mental health, so that people start talking about it, people start acknowledging it. And this is something which has been a major challenge in understanding health. Okay. Now, mental health, if we have to understand it or describe it, how does one do it? And this is something which is more practical, rather than scientific aspect to mental health, is that it is a capacity to live a full productive life. Okay. But as well as having a flexibility to deal with its ups and downs. So obviously life is not going to be giving you lollies, as we tell in terms of cricketing world. You get lollies and every time you hit sixes or you hit fours, there are going to be googlies, there are going to be bouncers, and we have to be mentally ready for that. And unless and until we develop those resources, unless and until we develop those coping strategies, we are not found to be in a good, stable mental health. So that's something which is very important aspect of overall mental health. So it's not only living life a full and productive way, but also having flexibility to get adjusted to it. There is a component which is age appropriate, and we need to consider, and at least it is very, very important in today's day and time, is about young people and children, because their life seems to be a little different than from adults. Obviously the kind of exposure that they have, the kind of resources that they have, I think this makes more sense, that for them is also a capacity to learn different things in life, enjoy friendship, social interactions, to meet challenges, the various challenges that they come across in their life, whether with regards to their academic activities or with regards to their social interactions. They should be able to meet them and also develop talents and capabilities. So this is how we typically describe mental health, though not very scientific, but practically appropriate understanding about mental health. And this is where the whole understanding about mental health starts. And when you talk about mental health, it has been a phenomena which has been an age old thing. I always feel interested in understanding the history, and the history about a particular subject forms the basis of understanding that particular subject. And there are basically three views in which the development of mental health and awareness about it has gone through. The basic understanding about mental health started with the supernatural theory. People always felt, and I'm talking about way before Christ, we are talking about 9,000 years ago, where there were some issues which were recognized, and the change in behavior, the change in emotions which were recognized. And that time it was all about supernatural theories. What they perceived is that mental illness is basically a possession of evil and demonic spirits. It's also displeasures which is showered upon us by gods, various geographical phenomena like eclipse, planetary gravitation, curses. And those all things brought about the changes as far as our behavior is concerned, as far as our mental health is concerned. So this is one thought process which was held very strongly during many years ago. Then came the understanding of psychogenic theory, where people started thinking that it's not something to do with supernatural powers. It's something to do with the relationship that we have, the environment that we live in. There are issues with regards to the experiences that we have. There are problems with regards to the learning that we take throughout our life, the maladaptive pattern, the abnormal ways that we handle or mishandle a particular phenomena, and that probably affects our thought process, and then ultimately starts having an impact on our behavior. So the psychogenic theory came in for during the early 17th or 18th century, and during that time, or even before that, I think Hippocrates' oath is very well known in our medical and paramedical field. But Hippocrates was the one who around 600 BC described that there are some imbalances which is happening in our body, and there are some issues which are there in our body with regards to the chemicals that we secrete, the acidity, or the various secretions that we have, and imbalances in those secretions or the hormones or the enzymes causes mental health issues. So that's where the first uh, aspect or the first seed of it being biological or within ourselves came into the fore, as opposed to the earlier thinking where it was more about supernatural theories and the environment which was playing a role here. So and why this piece of history is important, because that also dictates the way we perceive mental illness, that also dictates the way we treat mental illness. And this is something which I would want to show you. In the supernatural era, when we believe that mental illness is something which is to do with supernatural powers or evil spirit possessing you, that's where the treatment was such harsh, like drilling hole in the skull. That particular process was called trephination, where people with mental illness were made to release the spirit that were possessed by drilling hole in the brain. They at least understand that since they are behaving bad, there is something wrong in the head. They did not drill hole in the chest saying that there is a problem in heart or liver or any other part of the body, but they felt that drilling hole in the skull would make the evil spirit disappear. And that's why the understanding about a particular problem and the development becomes very easy in the era where the somatic theories were floating around very strongly. People started feeling compassionate about this people having issues of mental health, and the whole concept of mental asylum came into picture. So they were given a shelter, they were given a particular place where everybody came together, and institutionalization of mental health care came into the picture. But then this was again not the best thing that could happen in care of mental illness or mental health. But then it was definitely better than those root treatments which were there in picture uh, in the supernatural era. And during the era of the again the similar phenomena, the similar understanding about somatic theories, the psychoanalysis, the father of psychoanalysis, Sigmund Freud, gave us this particular couch phenomena, where you sit down and just do a free association. You talk about your problems, you get it out. Obviously, there are things which are just free flowing, and there are things which are guided. You are spoken and ask questions, and you come out with problems, and within those discussions you also come out with certain solutions. There are issues with relationship, there are issues with environment that are coming out. So the reason I'm discussing this particular piece in my presentation is that the perception about a particular problem also dictates the kind of solution that we give to this particular problem. So mental health in last 9,000 plus years has gone through a lot. And today, as we are in 2020, the things have changed a lot. We have now a very, very strong belief and a lot of evidence to understand that mental illness is having a very strong biological basis. And when I say biological, obviously, what Hippocrates talk about, the imbalances in the body, we have focused mainly in the brain and the imbalances within them, as shown in this particular picture, where it's this particular diagram is called a synapse. It's a these are two brain tissues which come together, and activities there within them, the chemicals flowing within them, is something which dictates our brain function. So whether you are thinking something, or you are having certain emotions, or you are behaving in a particular way, all the brain functions, even your cognitions like focus, concentration, everything gets dictated by activities happening at this particular junction. And this is something which forms the basis of majority of our treatment. So we have come a long way. Also, we are going much more deeper into the brain, because this is more the synapse theory, or the neuro chemical imbalance or neurotransmitter imbalance is also based on a reverse understanding, where we have certain drugs acting on them, and that's why we believe that the imbalances happen at that particular level. But now, with the advancement in the science, technology, imaging, such a wonderful picture on the lower right border of our screen. This brain uh, scanning shows various tracks, various areas which are functioning in different ways. The motor areas which we are all aware about in area of physiotherapy is there in the middle: green, purple, red, and brown. Also, the cerebellum, which is again very, very important in the motor function, which is there in the in the green and purple, light green and the purple. So we now know the various tracks which are functional in certain states, which tracks are more active, which tracks are less active, and that forms the basis of our treatment and understanding of mental illnesses. And obviously, another challenge was to have a consistency throughout the globe. You can't have, because malaria is called malaria even in the US, diabetes is called diabetes even in the US. But early on, we had issues about understanding mental illness across various countries and religion and culture, and that's where the manuals were developed. This process started in early 1950s, where 1951 we had a first diagnostic and statistical manual. American Psychiatric Society took lead in coming out with such manuals and publications, which gave us a standardization of mental illness, which can be employed not only in the clinical practice, but also in doing research. Because unless and until you have standardization, you have understanding about the illness, the symptoms, you will be able to come up with medications, you will be able to come up with therapies which have impact on them in a positive way. You are able to come out and recover in a big way. So it's the full journey which mental health scenario has made, the mental health illnesses has made, from supernatural theory to brain-based understanding. And this is something which is a big, big leap. And we are also going to an era where we are getting to know the exact site, the exact locations where you'll find issues with depression, issues with anxiety, issues with other aspects of mental health problems like substance abuse and other psychotic illnesses. And it's an era which is extremely fascinating. Now, whether we are ready to develop medications or interventions to correct those things, well, it is still extremely early. But then when you have a problem in hand, then the solution can definitely come. When you know that a COVID virus or the SARS virus is having a particular structure, development of vaccine happens according to that. So when you have a problem, the solution comes. So in terms of understanding the brain, we are getting closer and closer, and awareness about mental health and the problems have definitely risen many folds. And this is something again is very important, because we have to think from the biological point of view. We have to understand that there are genuine changes in the brain happening when we feel or perceive something. When a person feels sad, when a person feels anxious, it's not that it's his weakness, or it's something to do with the personality. He has to overcome it on its own. And this perception has to change at the early age. You don't tell a person who is having tuberculosis that please don't cough. Why are you coughing? We know that person having TB is going to have cough, is going to have weight loss, is going to have fever. The adjustment and understanding with those symptomatology and syndrome is so well understood. We are getting into a zone where mental health also is understood and perceived in a similar way. Having a strong biological basis, yes, the triggers can come from the environment and the various factors around, but then what goes wrong is a strong biological basis, and that needs to be corrected to at least initiate the change. Then once we have the change, then the other factors come into the picture. Why we have to talk about mental health so much, why we have to have this webinar, why we have to have a separate day to celebrate them. We have say Father's Day, Mother's Day, Teachers Day. Why we have to have a mental health day, and that too at the global level, recognized by a global agency of lot of repute. And I'm going to share in next few slides why mental health is important. The number one which I want you to have a look at is overall impact that it has on the morbidity and the disability. Now, any illness, how impactful it is, dictates the seriousness of the illness, dictates the issues surrounding the illness. And as we know, as on today, cardiovascular disease, the disease related to heart, is something which has the top slot. But then at number two, we have depression. And in coming years, I'm sure that position is going to change and change big time, where mental health issues, primarily depression, is going to take number one. And that number one spot, and that is measured primarily by what we call as the days, uh, years lived with disability, and the disease burden which a particular illness has. And here, as we see, among all the illnesses, the mental health issues, they describe or they account for almost 13% of daily activity lost. And that's something which is a very big impact. You have people who are having mental health problems, and they're not being able to perform their routine tasks, whether it is housewife not being able to take care of the house, or executive not going to the office and able to take some strong decisions, impacts the overall productivity of that person, and also the environment that it surrounds in. And here, among mental illness, as I mentioned, depression is the number one cause, and that needs to be kept in mind. So that's why talking about mental health is very important. Another aspect is conditions related to brain and mind are acknowledged to be increased in recent times. Obviously, the current pandemic has done no good in this particular scenario. We don't want mental health issues to go up. But then, yes, the kind of life that we are living in, full of stress, full of timelines, extremely strong pressures that everybody is living in, is definitely going to see the problems with regards to brain and mind going up. And as along with the stresses going up, obviously the awareness in the society has also gone up. What probably earlier was regarded as a supernatural theory, or people getting possessed by demons, has now been acknowledged as a real genuine problem. So that awareness has also led to more people coming forward and seeking help. Obviously, there are various changes in the lifestyles. People talking about having more sedentary lifestyle, lesser interactions, spending a lot of time in front of the screen, especially in the children and adolescent, which is one of the major concerns that we have in nowadays. And we talk about screen addictions, and how they are destroying children's life and other individuals' life. So these are various changes in the lifestyle which does make mental health as an important phenomena. Every aspect. This pandemic also has brought about a lot of challenges and has made sure that our mental health and the capacity is tested to the fullest. So every aspect of our life and the change in them does cause issues with brain and mind, and it is only going upwards. Uh, Obviously, another thing which we have to be aware about, that only person who does not have brain cannot have a mental illness, and this is something which I tell to all of my patients. Why me? Why they always ask me why I have been selected to have a depressive episode or an anxiety spell, and I always tell them, "Hey, boss, you have a brain and you can have a brain issues. Why we don't ask when we have a heart attack, why I only had a heart attack, why the other person did not have a heart attack." So these are certain presumptions, or these are certain understandings that we have about health, or especially mental health, which is very, very important to clarify. And what one needs to be aware about, that no one person is safe, irrespective of age, irrespective of gender, whether you are living in a bungalow or you are living on streets, whether you have an excellent living standards with all the facilities, or whether you are having some issues in your living standards. You have financial constraints, you have political upheavals, you have wars being fought in your countries, or you have one of the best quality of living in your country. So everything makes a difference, but it's not that you are safe from having a mental illness. Yes, the percentage might change. A country where quality of life is much, much better than the other obviously will have a lesser chances of developing mental illness as opposed to a country who is in war all the time. But yes, nobody is safe. Tomorrow, anybody with brain can have. So that means everybody is in a probability of developing mental illness. So this is again one of the hard hitting facts which we have to keep in mind. Uh, Obviously, there is a growing evidence from the research which has demonstrated a very close association of mental disorders as a precursors, risk factors, comorbid conditions, and consequences of wide range of acute and chronic conditions like non-communicable diseases, injuries, violence, maternal and child health. What I want to emphasize here is that it's not only issues related to the mind, but other acute or chronic issues. Person diagnosed with COVID. So that's been one of the major anxiety provoking or anxiety inducing thing that we see nowadays. Moment you have some kind of fever, cough, you start panicking and you start becoming restless, and you start having thought whether I have something very, very serious. So it's not a mental illness in individuality, but also the other illnesses. Very commonly we see people with Parkinson's, people with chronic diseases like diabetes, obviously, which has his own share of issues, have depression as a very common comorbid condition. Having a particular heart element and anxiety is depression again is very commonly associated with it. And it's not these factors are not only limited to the medical illnesses, also certain social issues like violence or abuses, they have a very high element of mental health problem associated with that. And we know that maternal and child health is something which is a very well known era, or the aspects of human cycle, human life, which is exposed to mental health related problems. So that's again something which I have to keep in mind, that like in case of females, we have menstrual cycle related issues, postmenopausal syndromes, post-pregnancy blues. So these are some phenomena which happens to them only on account of they becoming pregnant or they being a female. So this again is something which is not directly related to brain, but body goes through certain changes and the brain gets affected. So it's not only brain as an individual organ, but also the other system backfiring or having some issues will start showing changes in the brain and mental health. So we are looking at a picture which is quite big than what actually is, like how we typically describe as a tip of an iceberg. And this is again phenomena which we have to understand and be aware about and treat. Another aspect which is very important here is not only their existence is important, but treatment in those comorbid condition becomes also a very important phenomena, primarily because it dictates the overall outcome. Suppose if we take diabetes as an example, or a person who has gone through an acute myocardial related illness, and you are trying to do some sort of physiotherapy, you are trying to mobilize the patient. But if he is in depression or in a pessimistic state or denial, he is not going to cooperate. So the recovery related behaviors, the diet that he has to follow, the sleep that he has to have for body to recover faster and better also gets dictated by your mental health. So I think it's one of the phenomena which is very important, and not only in individuality but in totality with other aspects of health. Mental health has a very strong impact, and that's why you cannot ignore it. As I've discussed earlier, the mental health disorders or the mental disorders are caused by complex interactions of biological, social, environmental, cultural, and economic factors. So there are a lot of things which are coming into fore, and we have to focus on things which we can change and work on. And that's something which becomes very important aspect of recovery. In biology, I would like to just make a small mention here is that your family history or the genetics does dictate the kind of problems that we have. We've very commonly seen that anxiety disorders running in the family, mood disorders running in the family, the other types of psychiatric disorders running in the family. So they are very important aspect and have a very strong biological basis. But if you talk about a country like India, there are other determinants, social determinants of health like employment, education, living standards, the environment, other access and equality, other are also important contributory factors for both causation as well as recovery. I can tell with guarantee that yes, things are changing. Recently, we had a particular directive from the government of India where mental health and related issues are also part of insurance coverage. So even if you are going to a psychiatrist or a psychotherapist for treatment or correction, those uh, bills can also be reimbursed. The OPD based treatment, not only the indoor treatment, but the OPD based treatment. So definitely the perception is changing, the system is changing accordingly. But are we there yet? No. A lot of things needs to be done because in proportion to the steps that we are taking, the problem is going much ahead. So it's probably 2-3 steps ahead from what we are. But then, but at least it shows that you have the right intention to change it or challenge it, and it will definitely make a difference for days to come. So that's again one of the reasons why you can't ignore mental health. Some of the mental health conditions are implicated not only in lower productivity or earning potential, but also in number of antisocial behavior. So when you talk about various crimes, people are talking about in COVID times where the unemployment is on a higher side, you are going to see crime rate going up. Also, you in the people being locked down in the house are going to see more issues at home, the relational problems. There was some study early on that divorce rates have gone up. But what needs to understand is that when your mental health gets challenged, yes, you also see issues which are more social in nature. The thefts, the murders or the crimes, and also the domestic violence, the substance abuse, everything goes up. There is a very strong belief that when you talk about substance abuse, there is some mental health issue which is uh, playing in the background deep down inside, and that's why you see problems with substance abuse on a high level. So that's something which is again a very important. It does not only affect yourself, your system, but also has a strong effect on the society and the overall stability. That's why you cannot ignore mental health, and you have to take care of it. Finally, I think from a cultural perspective, mental disorders are associated with considerable stigma. So this is one aspect which we have been talking from early 50s and 60s, where the first drug was developed for mental illness, and till today things are still uh, not drastically changed. We do get referrals from Bua Babas uh, just because they are more aware than the patients. But then the first point of contact still remains a person who is into spiritual healing, who can change the spirits or draw out spirits within them. And I'm talking about not rural areas, I'm talking about cities like Bombay. Here also, we have a lot of stigmas, lack of awareness associated with mental health, and that's something which has to change at the earliest. This is something which we have to make sure that change at the fast pace, because every day you spend in having a mental health issues, whether it is depression or anxiety, it definitely affects your mental health and overall health in a big way. So and it's also the society how it approaches. So once you have an awareness about person having depression or person having problems with mind, the family is challenged, the family is discarded, or family is not being made part of the society. And I'm telling you, it's even happening today. Moment a person walks into my clinic, I see the body language and I see the kind of discomforts that they have. But at least the kind of practice that I have, seeing people around, they feel comfortable that they are not the only ones having this kind of problems. And I always give that as an example, that you are not the only one. See the amount of people which is sitting in the waiting room. So that at least makes them feel comfortable. But I can tell you, even now, even till today, though the situation is changing, but people feel extremely uncomfortable walking into a shrink's chamber. So after reality check, I think there are certain numbers that we also have to be aware about. Prevalence of mental mortality is high in urban metro, obviously, because the kind of stress and issues that we go through. It's said that urban life is more challenging and stressful than rural life. But then, if you look at the farmer suicide and the incidences in that particular occupation, I think this particular aspect can definitely be challenged. It's not that it is only an urban phenomena, rural phenomena. Rural places also have their own issues and problems, and it definitely has an impact on mental health. 1 in 20 people in India is suffering from depression. So we have around 40 plus people participating here, and we can make a calculation. So 1 in 20 people that you interact, meet, see will have or might have suffered from depression in their lifetime. So this is again a very astonishing fact. Imagine the kind of population that we have and what numbers that we are looking at when we talk about mental health and depression per se. Nearly 1% of Indian population reported high suicide risk. So I've not spoken about suicide at length. We just spoke about mental health and its impact in general, but this is one aspect of mental health and its outcome which is very important for us to take care. You cannot ignore the kind of emergency that we are handling here. It is as bad as having a cardiac arrest. It is as bad as having a kidney failure, and you have to make sure that the right resources are provided, right help are provided. And the next number is definitely going to make my case even stronger about suicide. Is that in 2019, India reported 381 deaths by suicide. And this is across all the age groups. We are not talking about elderly or grown-ups. We are talking also about children here. And this primarily implies every 4 minutes there is a suicide which is committed. And it's a serious problem. We are not talking about attempts here. If we talk about attempts, then it will go in few seconds that person is committing or trying to do something. But these are completed suicides, 381 deaths every day in 2019. And imagine the kind of scenarios and the social issues that has developed in today's day and time, and what those numbers. I feel extremely scared when I look this number. And only way we can help them is to create more and more awareness. And again, this aspect is very, very important. Most of the mental illness, if you see, affects the productive age group the most. So you are looking at in 20s till 40s, where you are supposed to be the most productive, and mental health issues, they affect that particular aspect the most. And this is again one aspect or one thing which we have to make sure that it changes, that it changes uh, completely and changes the most. No doubt, the other extreme, the children and older age group also can have mental health problems, but then obviously we are concerned about the productive age group, because that's the one which dictates the stability not only for self but also the family that they stay in, and also for the society. So it's again something which is a very important number that we cannot, or the fact we cannot ignore. Okay. So it starts with being aware. It starts big, having some understanding about mental issues, and as we talked earlier, depression and anxiety. I'm going to touch upon only these two illnesses, and then I'll go to the basic understanding about the treatment and finish my presentation. When you talk about depression, these are the symptoms that we typically feel. You have a lack of interest, you have feeling of sadness, you lack concentration, you have anger outbursts, tiredness, energy is not there, obviously your appetite and sleep gets disturbed, and in extreme cases you have thoughts of death. So this is something, these are the symptoms which coming together forms a depressive syndrome or depressive disorder cluster. And one might feel that, okay, we do this, feel these symptoms on and off basis, or at times on a regular basis. But there is a criterion there that you have to feel these symptoms at least for 2 weeks consistently. And you also have to have a strong, significant functional impairment. So, as a housewife, you are not able to function your home activities. As an executive, you are not able to go to office and take your decisions. As a student, you are not able to perform your studies, and you are not able to perform in your examination. So, functional impairment, very, very important, along with the duration and presence of symptoms. So, this is something which forms a depressive cluster. Again, for awareness, that when you look for this sign, strong enough, long enough, please go ahead and talk to somebody. Talking about anxiety disorders, well, anxiety disorders is again a big cluster where you have different kind of phobias, like social phobia, specific phobias, and generalized anxiety disorders. But what is core to the anxiety disorders is having a panic attack, or what we call as an attack which is similar to a heart uh, going fat, but it originates from the mind. And these are the symptoms. When you have a panic attack, you feel chest pain, you feel increased heart rate, you feel sweating, trembling. It's exactly like same is exactly like you having a heart attack. And we have had instances where people have rushed to ER, emergency room, and got the basic treatment done. And also at times you have seen people, the medical professionals, they are over enthusiastic. They have also undergone various tests, including angiography, ultimately turning out to be normal. But it just takes awareness, little bit of history taking, understanding that person had a trigger and had this kind of phenomena, and the age group, the other factors which comes into picture for us to come to a diagnosis. But then again, panic attack is something which is core to the anxiety syndrome or anxiety related disorders, and having an awareness about it always makes us look for it. So as they say, that unless and until you are aware, you will not look for things. So to be looking for things, you also have to be aware about things. So this is something basic as far as depression and anxiety is concerned. I'll take more in question answers if you want to understand mental health and their symptoms in details. But then I'll move ahead in terms of managing mental health. Now, I have given a particular order: medications, psychotherapy, other treatments which are also available nowadays. You have to also look at prevention of medical mental illnesses, and also promotion of mental health. Ideally speaking, the order that I have given is true primarily because we get cases which have already developed some sort of florid mental health issues. So depression, which is reasonably severe, anxiety disorders, which is impacting the function of a particular person. But ideally, it has to be the down upwards. You have to start with promotion of mental health, prevention, and then try to avoid any of the other interventions and approaches, maybe talking to somebody, psychotherapy, doing the job for you. But then few tips about medication, I thought as a psychiatrist, I have to mention that treatment of mental health diseases, as we discussed earlier, has a strong biological basis behind it. The medications which are given are either antidepressants or anti-anxiety medications or antipsychotic medications, which treats the disease which is there within you. You have to be taking it in under supervision. You have to follow the protocol which is prescribed to you by your doctors. Even if you are feeling better, do not stop medication. It has to follow a particular routine regimen. Like how for TB you have to take medicine for 9 months, you can't stop in between. So it's again a very important aspect. You can't stop because this type of problems, they have a tendency to recur. If you do it prematurely, it is going to bounce back and have more impact. So that's something which is again a very important aspect you cannot ignore. No, they are not the drugs which makes you addictive, primarily because you take it under medical supervision. Anything that is done under supervision with a lot of awareness and evidence backing it cannot have a negative impact. Do they have side effects? Yes, every medicine has a side effect, but they are primarily given for their effect, but not side effects. So these are some basic awareness and understanding. Again, I'll take questions as and when we go into the discussion. But then what we have to at least take home from this particular slide is that please go out and seek help. That's something which is very, very important. Don't be shy if you are prescribed medications. Be in touch with your therapist, be in touch with your clinician, and I'm sure you can come out of your mental health problems, whether it is depression or anxiety. Well, of course, it's not as easy. There are certain challenges, lack of awareness being one of them. And the steps like this today, the CME that we are doing definitely is changing it, definitely is making scenario much, much better. But are we there yet? No, I definitely don't feel there is a lot of stuff that needs to be done in the area of creating more awareness. But even if you are aware, we see problems at the level of acceptance. People do not accept that they have a mental health issue and they need to talk about it, whether they see it as some sort of weakness or inability, but then they see that acceptance comes, the problem becomes even that more easier to handle. So that's something which is again very, very important. Prevailing misconceptions are doing no good in area of mental health and making life more and more challenging for people who is going through it or people trying to handle it. The first challenge comes from the medical counter where they are a drug counter where they are going to get their prescription honored, and the question is asked, why are you taking this medicine? Are this medicine for you? And that's the reply which I get from 9 out of 10 patients. Imagine, the pharmacist has no business of talking about medication. He just has to dispense what the doctor has written, but still they have an opinion. And that perception has to change. Unless and until we make that impact, things will not become good as far as mental health is concerned. And obviously, in a country like ours, we do have scarcity of resources. When we are doing the recent math, one doctor for almost 400 to 500 people, and that's a very bad. And we are talking about doctor in general. So imagine the kind of problem that we have in our hand and the scarcity of resources that we have is definitely not making the care of mental health easier for us. What can I do as an individual? Because it has to start with us. As our prime minister has said, okay, you have to become atmanirbhar. So that's something which is very, very important. So what you can do, you have to learn to recognize the signs early. Unless and until you are aware, you'll not be able to recognize. So read about mental health, attend such CMEs, and start recognizing sign early. Understand their cry for help. So whenever people are telling that I need help, I need to do something, I want to talk about it, I am feeling this, don't marginalize or ignore those things. At least listen to them. And after listening, obviously they will feel better because you are able to take the pressure out. But then whether it is good enough, if it is not, if they are still consistently having problems, then obviously start seeking help. Ask them to seek professional help. That is something which is very, very important. So that's the acronym what I made is rule. Recognize the signs, understand the cry for help, listen to them if you are if you are a caretaker, and obviously encourage them to seek professional help. So if you follow these basic criteria, we have done enough. Probably you have saved a life committing suicide, or a life which is going into a functional disability and destroying themselves. So that's where I'm going to finish my presentation. Thank you all for patient hearing. But before I finish, there is just one thing which I want to say, is that mental health obviously begins with me. First, you have to take care of your own health, your own mental well-being. If you are stable, if you are strong, you will be able to provide help to others. So always look after yourself and your mental health first before you start helping others. Like how they say in plane when we are traveling, that you first put your mask and then help others who need the assistance. So start with you addressing your mental health issues, talk about it, seek help as and when needed, but then ignoring is definitely not the way out. Thank you all for patient hearing, and here I'll stop my presentation.
Thank you, Dr. Jai, for a very informative session. Okay. And now I would like to introduce Dr. Tanvi Tanna. So Tanvi Tanna is practicing clinical psychologist and rehabilitation therapist with more than 10 years in the field of mental health. She works with children and teens having emotional behavior or academic issues like low attention span, hyperactivity, exam anxiety, or anger issues. She also helps in adults struggling with addiction, depression, anxiety, stress, and martial conflicts. She regularly conducts workshops on social emotional intelligence, anger management, rational parenting, psychotherapy, disturbances, morbid, psychogenic, psychotherapy,
We are facing some technical difficulties. Please bear with us. So I would like to introduce Dr. Tanvi over here. Dr. Tanvi Tanna is a practicing clinical psychologist and REBT therapist with more than 10 years of experience in the field of mental health. She works with children and teens having emotional and behavioral and academic issues like low attention span, hyperactivity, exam anxiety, and anger issues. She also helps adults who are struggling with addiction, depression, anxiety, stress, and marital conflicts. She regularly conducts workshops on social emotional intelligence, anger management, rational parenting for the families and schools. So she practices at her clinic located in Kandivali in Mumbai with masters in psychology and advanced diploma in counseling. She has received advanced certification in REBT from Albert Ellis Institute, New York. She also has received certification in couples therapy from Gottman Institute, Seattle, USA. She firmly believes that emotional disturbance is self created and one can get better by changing their irrational and negative thoughts. So, with this, I would like to hand it over to you. Tanvi, you can please carry on. Your audio is your audio. Please switch on your audio. Yeah.
All right. Thank you so much for the warm welcome. Good morning, everyone. Thank you, Indian Association of Physiotherapists, for organizing such an important topic, that is mental health. I also thank Dr. Riddhi and other team members for giving me this opportunity to share a little bit on mental health. And a big thank you to Dr. Jay for making the presentation so simple for us to understand and so easy for us to practice. Thank you, Dr. Jay, for sharing your experience with us. All right, so after looking at history of mental health and symptoms of anxiety and depression explained really well by Dr. Jay, I'll be focusing on treatment goals for anxiety and depression. Like Dr. Jay said, we are going through pandemic, and because of the pandemic, all around the world, mental health issues have risen. In India, we have seen a 40% jump in the last 6 months. According to WHO, yes, depression is the largest killer after heart disease. And we have also noticed people who are depressed also tend to have suicidal thoughts and unfortunately commit suicides. So even more important for us to take care of our mental health during the pandemic. Yes, about 85 to 100% of patients with anxiety disorders have comorbidity with depression. Negative self-talk. It has been observed again and again that negative self-talk has direct correlation with anxiety and depression. And like Dr. Jay told us, that it is awareness of our negative beliefs that will help us replace those negative beliefs more effectively and manage our mental health better. So what is disturbance? A very popular philosopher said that people are not disturbed by things, but the views they take of them. What it means is we are not disturbed by what other people are doing in life. We are not disturbed by situations. We all are going through pandemic right now. Some of us are more anxious. Some of us are more depressed. Some of us are angry. Some of us are able to deal with it better. What it means is even though the entire world is going through pandemic, we are not all equally disturbed. We are not all equally anxious. Why are we all feeling and behaving differently is because we all are viewing it differently. We all are thinking about the pandemic differently. People who are able to think flexibly are able to manage their symptoms better. So in any mental health treatment, we have two problems. We are looking at practical problem and we are looking at emotional problem. So let's say, for example, if I have to take a flight tomorrow to Delhi, okay, that's a practical problem. Now, emotional problem is maybe I am too anxious. Maybe I am scared of flying. Maybe I'm scared that if I get on the aircraft, I'm very sure I may get COVID. So, will it be possible for me to solve my practical problem? No, it's difficult. What happens now is I have to work on my anxiety. I have to work on my emotional problem first to be able to take that flight with reasonable anxiety. Or in REBT language, we call it rational concern, okay? That I'm concerned that I may get it. But I am constantly disturbing myself by saying I should not get it. I should not get it. If I sit, I will definitely get it. This self-talk is continuously making me emotionally disturbed. So to be able to solve the practical problem first, I have to work on my emotions. So it's very difficult for us to develop ourselves when we are emotionally disturbed. To focus on areas of development when someone is emotionally disturbed is to encouraging the person to climb a steep hill with heavy weights attached to their ankles. Remove the ankle weights and you are able to climb the mountain. Like Dr. J explained us very well in detail that yes, symptoms of depression, okay, that it has biological basis. It has, you know, it has our genetic history and family history involved. So I'm not going to explain it in detail, but what does symptoms of depression look like? Okay, that is, we categorize it into 4 symptoms. All right, the first is cognitive. What am I constantly thinking? One, am I thinking I am no good? No one likes me. I'll fail at everything I try. What's the point of even trying? These kind of negative self-talk is very common among people who are depressed. Emotions. What are some of the emotions that they experience? Worthlessness, shame, which Dr. Jay spoke about, right? The shame starts from right there where you are sitting at the shrink's office, or when you go and meet them, to get your medicines. They feel sad. They're not able to snap out of it. There is a lot of feeling hopelessness. Will this pandemic ever end? Okay. Is there an end to this? They cannot snap out of these negative feelings or thoughts. What are some of the physical symptoms that they go through? Yes, sleep disturbance, not able to sleep on time, insomnia, waking up in the middle of the night, sleeping throughout the day. They could be having sleep disturbances, appetite. They could be either eating a lot or they would avoid food. They may also experience weight issues, decreased sexual drive, a constant fatigue and tiredness, not wanting to do anything that is pleasurable. And like Dr. Jess said, a lot of brain chemistry changes are seen when people suffer from depression or anxiety or any other mental disorders. And what happens when you are depressed? What we look at is how much is the impairment, okay? Am I able to do my household chores? Is the homemaker able to cook and clean the house? Is the person's attention concentration so low that he or she is not able to focus at work? Is the person so irritable, so angry that it's leading to violence in the house or abuse in the house? Behaviors could also be withdrawal from positive activities. Initially I would draw and I would dance, but now I have lost interest. Okay, I'm withdrawn from people. I don't come across as happy person. I come across as odd or withdrawn or sad or angry, which leads to people judging me negatively. Self-care. I may have poor self-care if I'm depressed. I may not like to shower or keep myself, clean or neat looking. So how do we know? What is the difference between depression and sadness? Okay, so depression is, like I said, we notice when you meet a psychiatrist or when you meet a psychologist, we see how much is the impairment. Okay, what I mean is impairment is whether the person is able to take care of him or herself, whether the person is able to take care of his or her responsibilities, whether the person is able to perform well at work. Okay, so we see the intensity of these symptoms, the frequency of these symptoms, and the impairment. Where is the person suffering the consequences the most? So what is depression? Depression is of course, we may feel depressed when we lose a loved one or when we lose a job or when we've been diagnosed with some illness. We may feel depressed for some period of time, but depression can be pervasive. We may start seeing only negative aspects of loss. We may start focusing on the past loss and we may start predicting future failures. We only see blackness in the future. And what are our behaviors? Like I said, we may withdraw, we may create an environment that supports our depression thinking. Okay, I may not organize my room, I may not clean my room because that's how I'm feeling right now. So what is the difference between sadness and depression? Okay, yes, we may mourn when we lose our family members. It's natural. We may go through periods of grief. Okay, we may go through some sadness, but we may, come back after some time. So what is sadness? Sadness is when you are able to recognize both the positive and the negative in the situation after the period of mourning. You may think that, okay, I can help myself, I can bounce back. You may look to future with hope. You seek reinforcements. You talk to people. You start painting, you start drawing, you start going for walks again. So like Dr. Jay had told us, we also look at the duration of the symptoms, how long the person has been feeling depressed, what is the frequency, and what is the intensity and impairment of these symptoms. And of course, people with depression struggle with struggle with suicidal thoughts, which may not be the case with people who are just experiencing healthy sadness. Quickly going through symptoms of anxiety. Anxiety is fear. It's excessive fear. It's overreaction, to anticipated threat. Anxiety symptoms can also be classified into cognitive, affective, physical, as well as behavioral. So cognitive could be, oh my God, I'm losing control. Okay. Oh my God, if I'm going on tomorrow's flight, it is surely going to crash. Oh my God, what if it experiences turbulence? Or fear of physical injury or death. I'm scared I may lose my parents. I'm scared that I may die. Okay. Fear of negative evaluation by others, frightening thoughts, I'm sure I'm going to fail tomorrow's exam. Poor attention concentration, hypervigilance about the threats that's happening. The emotions that I struggle with, when I'm anxious, could be feeling extremely nervous, feeling tense, restless, edgy, and jittery. The physical symptoms that I could experience is nausea, shortness of breath, muscle tension, chest pain and pressure. And the behaviors that I would want to engage in when I'm extremely anxious could be avoidance of threat. I do not want to take tomorrow's flight. Restless pacing, thinking that I have to go. I may just reach Yogeshwari and come back. I may have difficulty speaking because I'm feeling so anxious about my presentation. I may freeze, or I may want to flight, classic depression features, where you are stuck with the problem, you freeze, or you want to escape, that is flight from the threatening situation. Again, what is the difference between a full-blown anxiety disorder and concern? Okay, so in anxiety, we overestimate the probability of threat happening. Okay, that I'm sure if tomorrow I get on the flight, I'm surely going to get COVID. That is overestimation of the threat. I underestimate my ability to cope. I may constantly keep ruminating, what if I get it? What if I get it? Oh my God, I'm going to die. I may not be able to cope with it. I create even more. I create mountains of my threats and my imagination. I may even get into more task irrelevant thoughts. Oh my God, the person sitting next to me just sneezed. Oh, he is not wearing the mask. All these thoughts starts interfering with my thought process. And then what my behavior looks like I said, I may come back. I may not even reach the airport. Second, I may ward off, Third, I may seek reassurance. I may keep calling my psychiatrist, or I may keep calling my counselor and friend, should I take this flight? Should I take this flight? I'm feeling very, very anxious. What is concern? Okay, concern is, yes, I am realistic that the threat can happen. I'm realistic that there may be a chance that I may, get COVID. There may be a chance that my flight might be turbulent. There may be, I'm realistic, okay, about the threat happening. What is also realistic about appreciation of my ability? Okay, if in case I meet somebody who's positive on the flight, in case, I have good immune system, maybe I'll fight it out. Not necessarily I'll get it. Not necessarily me or anybody on the flight could get it. I do not create even more negative thought. I do not make big images in my head, big frightening images in my head. I face the threat, Yes, concern is I am worried about my health. I'm worried about the safety of my flight. But I'm not over concerned. I'm not over worried. जितना ध्यान देना है उतना ही ध्यान दिया है. कुछ ज़्यादा ध्यान नहीं दिया है. So I live up to the threat. I'm still feeling little uneasy, but I'm able to achieve my goal. That is, I'm able to take the flight. So depression, ways of thinking, that is, we have negative view of the future. Okay, I'm constantly thinking, the world is a bad place, that people are really, really mean. People are there to get me. No matter how hard I work, I'll never be successful. I have negative view about myself. I may constantly blaming myself, like Dr. Jay told us, right? That I may be blaming myself. Why me? Why am I the one who's got depressed? Why do I have anxiety? And I keep blaming myself. Then I have negative view of the world. That is, the entire world is unsafe. The entire world is a bad place. So we are stuck in this cycle of negative thoughts about self, about us, and about other people. So one of the goals in dealing with depression is helping clients become self-aware of this self-talk. What comes first? So when you first attend a mental health class, or when you visit a psychiatrist or psychologist who is especially trained in REBT or CBT, what they teach you is our feeling is largely influenced by how we think. And if we are able to change our thoughts, we can change our feelings and we can change our behavior. And any change in one of the things, in this triangle will influence thought, feeling, and behavior. They three are constantly influencing each other. So if I want to reduce my depression to sadness, if I want to reduce my anxiety to concern, I have to be aware of my self-talk. I have to be aware what kind of beliefs am I engaging in. Am I engaging in helpful beliefs? Am I engaging in stubborn thoughts, like they say? Or am I engaging in flexible thoughts or helpful thoughts? If I force myself to think rationally or flexibly, then I am able to change my negative feelings. So what it means is, of course, positive events lead to positive feelings. That's what people tell me. We went to a birthday party and we enjoyed it. It was such a beautiful birthday party. Everybody participated. My children performed well. Others are making me happy. Okay. Oh, my car broke down. My car is making me anxious. My car is making me angry. But is that really true? Like we saw in earlier flights, the same situations can have different thoughts and different feelings and different behaviors. Okay. Not necessary that if all of us are enjoying of the pizza, we all would love the pizza right now. Some of us would hate it. Some of us would like it. So even though we are experiencing the same situation, some of us would ask for one more because they have liked it. Some of us would feel disgusted and would keep the pizza. It's all because what we are thinking right now about about the pizza, right? So same situations don't lead to same reactions. What leads to reactions is our self-talk. So apart from biological tendencies, genetic history, physiological basis, which puts us at more risk for depression because we have history of depression in our family, so along with pharmacotherapy, we can also, when we come for counseling, what we will be working at will be largely working at what kind of thoughts, okay, what are my triggers that are increasing anxiety and depression. So what is A is everything, that I have gone through in the past. Okay, it could be losing my parents, it could be my medical history, it could be my present experiences. I've lost the job, it could be the way my family members are treating me, so everything, all the all the negative activating events could be my problem, okay, which could be increasing my depression and anxiety. So A is activating event. B, what am I thinking about these events? What am I thinking about my past? What am I thinking right now? Okay, will determine whether I become depressed or whether I become sad. Okay, so further, because I'm trained in REBT, REBT means is rational emotive behavior therapy. That is, at any given time, the belief, okay, the core beliefs keep getting triggered every time you are experiencing an adversing event. And there are two kinds of beliefs. One, is a rational belief. A rational belief is the one that is flexible belief, a practical belief, that will help you reach your goals. Okay. Irrational belief is negative belief, extreme belief, um, uh, a stubborn belief, which will not help you reach your goals. So in therapy, the client learns is this diagram. In counseling, we teach the client that A into B is equal to C. A lot of time, clients say that A is causing C. My father is making me angry. My mother is making me anxious. My mother keeps putting pressure on me. My mother-in-law, keeps criticizing me. You got to change them. Change the A. Only when my environment will change, only when my partner will change, will I feel will I feel happy. Till the time you do not change, my surroundings, I don't see myself improving. But that's not true, right? Most of the time in life, we may not be able to change the activating events. We may not be able to change the negative events in our life. But what we can change is what we think about these negative events. What we can change is whether we are choosing rational beliefs or we are choosing irrational beliefs. What we can change is how we change our irrational beliefs to flexible beliefs. So A does not cause C. That's the first thing a client learns in therapy, that is to take responsibility for their demands, for their rules, for their meanings, and that they are causing these feelings and not others. The first thing we learn in therapy is changing our self-talk, changing our perception, taking responsibility for our disturbance, and acknowledging that disturbance is self-created and it can be reduced and it can be managed better if you learn techniques to help yourself. For example, so yes, we're already in October, so it stopped raining, but it was pouring really, really heavily till the month of September and first week of October. So a person, and unfortunately we're in pandemic, so most of us are working from home. But what does rigid and flexible beliefs look like? It looks like this. There's an activating event that is heavy showers. It's raining heavily. Okay. If I'm engaging in a rigid, irrational thought process, I may be thinking something like this. I don't like rains. Rains make me sleepy. They spoil my mood. They spoil my clothes. I have to travel all the way to Andheri, and it's going to be so much of inconvenience. It should stop raining right now. Okay. And if it does not, I'm going to feel extremely angry. Okay. I'm going to feel extremely depressed. And and I'm not able to change my feelings because these feelings are coming from the showers. And now I'm so irritated and I'm so angry that I decide to sleep and report sick or miss my work and blame it on the rains. Okay. So what was the activating event here? What is actually happening is, yes, there is something that's outside your control, that it is pouring heavily. You don't like it. Till the time you keep thinking that I don't like it, you are not going to feel depressed or you're not going to feel angry. Okay. It is healthy to desire that, okay, I don't like rains. It's okay. This thought process is not going to make you disturbed. What is going to make you disturbed is the second level of thought process. It must not rain because I don't like rains. And I do not have to go through this inconvenience, all the way to my work. I cannot take it. This kind of thought process, that is, I want something to happen, therefore it must. Okay, when we engage that I want something and it should happen, is when we start feeling depressed and we start feeling frustrated. Okay, so what is flexible thoughts? Flexible thoughts are helpful thoughts. That, okay, I don't like rains, it is bad. You know what, but I can tolerate it, it's okay. thoda inconvenient hoga, but it is all right. Okay, I will still choose to go to work. I'm still irritated. I'm not happy that it's raining, but I'm irritated, and it's okay to be irritated because rational beliefs will lead to negative feelings, but of low intensity. And when you have low intensity feelings, you will find ways to enjoy the cup of chai while going to work, and you will reach your work. Okay, so, like Dr. Jay had told us, that it is acceptance that, okay, it's raining, let me do something about it. The more my beliefs, the more I'm trained to think rationally, the more I'm trained to engage in positive self-talk, more I'm engaged, more I help myself in thinking flexibly, the closer I will be to reality. Okay. But when will I go away from reality? The perspective check, the reality check is when I start looking at all the events in my life from these stubborn glasses, from these, rigid these glares which color the way I look at the world, and I demand that things should be different. When I start demanding that situations be different than what I want them to be, I will certainly remain depressed and I'll certainly remain anxious, because now we are demanding that things should be different than what they are. And this is not acceptance. And when we refuse to accept adversities or negative events in our life, we create mental health issues. So a lot of work in therapy is done in not changing the A's, okay, but changing your beliefs about A's, okay? It's about changing your beliefs about A's and helping you manage your emotion at C, and disputing your beliefs, not disputing how bad your mother is or your mother-in-law is or your partner is or teacher is, not disputing the A's, but trying to dispute your self-talk. Only when you are able to dispute your self-talk about the events, you will have a rational, a positive, automatic thought or a self-talk, which will reduce your disturbance, and you will be able to manage your anxiety and depression better. So what are some of the flexible beliefs or rational beliefs, that I want the clients to practice more and more? One is, I want something. Okay. I wish my dad was not so short tempered. Oh, I prefer to work like this. Wanting, desiring is healthy. Okay. It is logical to wish that, oh, I wish it was not raining today. It is consistent with reality. It is helping me reach my work. It's not spoiling my mood. It is helping me deal with things as they are. And it is helping acceptance leads to achievement. Okay, it helps me achieve my goals. What are stubborn beliefs or rigid beliefs or irrational beliefs? When I demand that others must treat me well, that the rain god should listen to me. And whenever I demand things to be different, I'm thinking of some magic, right? I'm already away from reality. I'm looking at reality with dark glasses. Okay. And then I try to question and I try to change the A, which is not in my control. And I blame A for making me angry and depressed and anxious. And then denial leads to disturbance because I don't like rains. It should not happen. I'm clearly creating disturbance because I'm denying reality. I'm far, far away from reality. So in counseling, we work a lot with reality check. We work a lot with demands. We work a lot with stubborn thoughts that are maintaining depression and anxiety. So when we engage in stubborn thoughts, when we engage in rigid thoughts, we are likely to experience negative emotions of big intensity and big frequency. That is anxiety, rage, violence, guilt that I am a bad person, depression, I am bad and whole world is bad, shame, I do not like myself and society is rejecting me and society is looking down on me, unhealthy jealousy, unhealthy envy and hurt. These kind of dysfunctional emotions are largely created by our self-talk. And if we can change our self-talk in counseling sessions, we can come to functional emotions. I'm not telling you to be happy, when you lose your job. I'm not telling you, to be, to celebrate, when you lose your job. Of course, it's a negative event. You're expected to have negative emotions, okay? So what are functional emotions? Functional emotions are still negative emotions, but are flexible emotions. They are low in intensity, they are low in frequency. You are able to manage them better. So anxiety would be concern, unhealthy rage would be healthy anger, guilt would be remorse that, oh, I wish I was good at math, oh, I wish I worked hard for the presentation. Oh, I'm sad that my pet died. Okay, I'm disappointed that people don't like me because I'm depressed. I may have healthy jealousy and, envy and sorrow, but these functional emotions will not paralyze me, but they will help me reach my goals. So it's okay to feel negative emotions when you are experiencing negative adversities. All right, so let's take an example. This is the cognitive behavior sheet, that we work, in teaching the clients how to take care, of their depression and anxiety. One, there is a situation here, which is I did not get promoted. Okay, the client came here and said, I did not get promotion, and my colleague Sham got it. Okay, and when I heard him, when I took his, when I was listening to his symptoms and his self-talk was something like this. I should have got it. I worked really hard for this. This is not fair. This means that I'm incompetent and I don't like Sham getting it. I don't like Sham getting it. I don't, I think my boss doesn't like me anymore. I really think I should leave this job soon because they're not recognizing my hard work. And what was stubborn thoughts led to was he started feeling depressed. Okay. He did not even tell his friend congratulations. He avoided wishing him. He sulked in one corner. He drank to cope with his negative feelings. And he decided to be off from work for a few days because he couldn't stop sulking and feeling depressed about him not getting promotion. So of course, with few counseling sessions, explaining him the ABC model, I had to help him dispute his rigid thoughts and make it flexible. And how does flexible thought sound? That I really wish I got that promotion. I had worked hard, but there is no guarantee that because I worked hard, I should get it. Okay, it's not fair, right? But world is not a fair place. At least I got shortlisted. I'm able to see him another positive point that, okay, at least he got shortlisted. Therefore, it doesn't mean that he's incompetent. To call himself incompetent, he has to perform incompetently 24/7 if he is giving himself such a big label. And then, of course, telling himself that it's disappointing that he's not got it. It's inconvenient. It is painful that he's not got it and that he missed this time, but he can try again. With this kind of flexible self-talk, forcing himself to think flexibly, forcing himself to dispute with his thoughts, he was able to have negative, feelings after some time, negative healthy feelings, that is sad and irritable. He did manage to wish him, he was able to, feel hopeful again for another promotion, and he was able to thank his boss and others for helping him nominate. So that was something about depression. What is anxiety? Okay, a lot of students, suffer from anxiety. I have to pass tomorrow's exam. It will be end of the world if I fail. My parents will not forgive me. My relatives will keep looking down on me. The entire world will think I'm a loser, and my life will be ruined. I don't know what's wrong with me. I can't even remember anything. I can't remember anything. Oh my God, this is complete waste of time. I can't recollect. I'm just sitting with my book and I'm having these automatic thoughts. Oh, I'm feeling so anxious. I'm feeling so anxious. And now I'm breathing heavily and I'm feeling, panicky, and I'm sweating, and I just close my book, and here I am feeling panicky that, oh, I'm sure I'm going to fail. Okay. And I really want to avoid exams, and I start calling people and I find ways to fall sick and avoid my exams. How do I help with somebody who's so anxious? Okay. Anxiety is overreaction to perceived threat. So concern. What does concern thought look like? Okay. So when I met this boy, we work from that he wanting to pass the exam doesn't mean he has to pass the exam. Okay, there's no demand that he has to. He can do what's in his control. That is, I want to pass this exam. I do get nervous while preparing for exams. I do remember few things, okay, that I studied. It's okay that I'm feeling anxious. Okay, it's okay. Okay, failing will be bad, but it's not going to ruin my life. Yes, my parents will be unhappy, my relatives will look down on me, but I can certainly stand it. I can stand that rejection. Okay, I want to pass does not mean I have to. I just took the practice test yesterday and I did fairly okay. Okay, my marks are low, my marks are low. I can do something about it. Okay, let me focus on what's in my control. That is my effort. That is changing my self-talk, taking deep breaths. I will give my best attempt and adjust my life to the outcome. Okay, now with this kind of self-talk, which is realistic, okay, that there is still a chance that I may fail, but I really want to pass. Okay, now I'm rehearsing flexible thoughts. I'm tolerating these anxious thoughts, that it's okay to feel anxious. I'm gathering evidence why I may not fail. I'm gathering evidence that even if I fail, it's not the end of the world. People move on and people get on, and I may find other better things in life if I'm not able to crack this MBA entrance exam. And I focus on deep breathing, and I share my worries, and I go back, okay, and I go back and I start studying again. I don't give up. I just manage an anxiety situation, a panic attack, better, not by running away from exams, but changing my self-talk. So yes, a lot of focus is giving these worksheets to clients, is to talking, is to talking about these worksheets. What was the client's triggers? Okay, what he or she was thinking about himself, what he or she was thinking about the world or about others that led to feeling anxious, or that led to feeling depressed. So one of the first step in counseling is correcting our self-talk, that is correcting the dark glasses, and changing our tunnel vision. So we engage in some kind of thinking errors, and we teach clients these thinking errors. I've listed few of them here, okay, which you can practice. But of course, there are many more self-talk, and there are many more thinking distortions or thinking errors that we engage in. Okay, the first one is I must and I should perform well all the time. I should not make mistakes on this presentation. Okay, I have to be perfect all the time. These demands from myself, and then I have demands from others. That my in-laws should treat me well, that my child should always respect me, that people should appreciate me and approve my decision. Then I have these stubborn thoughts about, oh, my family should not get the virus, my family should not fall ill, my family should not go through any inconveniences, and that world should be fair. Okay, so welcome to the Mustang trap. When you want something, you are not only that's healthy, but now you're disturbing yourself by making it rigid that I must get it, others should do it. And this kind of self-talk will definitely lead to anger if it is expectation from others, and will lead to depression and suicide if I have these stubborn thoughts about myself. The second kind of cognitive distortion, that is thinking error, that people with depression, anxiety, or other mental issues work, is catastrophizing. That is, oh my God, it's bad that I'm making mistake. Therefore, it is worst, and I cannot take it. Okay, so this kind of self-talk looks like this: my child failed in board exams. Oh my God, his life is ruined. There are a lot of parents who come and say, "Log hamare bare mein kya sochenge?" Our child is not a doctor. We are doctors. He's failed his board exams. His entire life will be ruined now. So they are making a bad thing equals to worst. How do you substitute that? Well, my child has failed in an exam. He's not a failure for life. It is unfortunate. He can still reappear and live a good enough life with other options. It is bad. It's not worst. Don't take a part of the event and make it whole. Okay, so making bad equals to worst. Catastrophizing. So either I'm beautiful or either I'm ugly. Either I'm the best performer or I'm worst performer. Either my child respects me all the time or he's a disrespectful child. This kind of self-talk, we always thinking in polarities or opposites. Another one is part equals to whole, you know, sorry. Just because the part is bad, just because I'm making few mistakes, does not mean whole of the presentation is bad. But we are quickly to jump that because it's raining, my whole day is wasted. Having anxiety means I am poor me, you know, I'm a mentally ill person. Probably I need to replace that self-talk with I'm still a normal person who struggles with anxiety. Low frustration tolerance. This is what we call resilience building. Okay, we work a lot on resilience. That is making low frustration tolerance equals to high frustration tolerance. Just because I'm struggling to manage my anxiety and depression doesn't mean that I am ill, or I am inadequate. Okay, just because it's a struggle doesn't mean my life is all bad. You know, I can't bear when others look down on me while I make mistakes during presentation. Just because I'm struggling, I say that I cannot bear it. Just because I have to study and it's a lot of struggle, I think I don't want to study. So substitute that with, yes, it's a struggle, but I can stand this pain. I don't like when others notice my mistakes, but I certainly stand making mistakes. I can also bear painful feelings of others looking down on me because it is worth it for me to be able to stick to my presentation and complete it. A lot of people, who suffers from stammering, they have this stubborn thought of, and also an LFT thought, a low frustration tolerance, that I must not stammer. And if I stammer, I will struggle and people will notice that I'm struggling. And I cannot take this pain when people are looking at me that I'm struggling and judging me negatively. So work on high frustration tolerance, that just because it's a struggle, just because it is painful, it is worth it. You can stand it. It's not going to kill you. This kind of automatic thoughts or self-talk will help you focus on your presentation, or help you achieve your goals. Black or white thinking, okay, where we are, like, there are no grays, like I said earlier, okay? My partner criticized me. Therefore, he thinks I'm incompetent, or that he hates me. Um, my flight is surely going to crash, just thinking in polar opposites. My partner criticized me, but I know that he still loves me. Okay. My child is not listening to me today does not mean, that he hates me. My child not doing the dishes does not mean he's irresponsible child. There are a lot of grays. There are a lot of positives in my partner. There are a lot of positives in me, even when I'm struggling with my negative issues. And that is called finding grace. And having negatives does not take away all the positives. This is so important. Me being in maths, my child failing in maths doesn't mean that he is bad at dancing also. The strength still remains. Okay, what we need to work on is helping him manage his negatives, finding the grace. Then another self-talk, is jumping to conclusion. That is jumping to conclusion. People with anxiety jump to conclusion that, oh my God, if there's a threat, then I'm sure I will not be able to cope with it. I got blank last time in the interview. I'm sure I'm going to get blank again. There is a guarantee. I know what others are thinking. I know my boss is judging me right now because I'm making mistakes. Jumping to conclusion without checking with others. I did make mistakes last time, but I can reduce making mistakes this time if I practice better. I will make mistakes at my job interview, but it is still I'm going to give myself a chance to go for that job interview. Okay, this kind of self-talk, that it's okay to make mistakes. It's okay to feel anxious. I am still going to go and achieve my goal. Another one that we see, which is very classic in relationship issues, in the family members, marital issues, is always and never. Whenever we start an argument, is you never remember anniversaries. You never get me gifts. This kind of thought process, which colors our perception towards our family members, which makes them very, very defensive and leads to a lot of arguments and conflicts. My child never spends time with me. Stop, think, check. Is it true? My child does not spend time with me. No, I remember yesterday we read last night together. Yeah, I think my husband did wish me 2 years ago, happy anniversary, though he's been forgetting from last 2 times, but he did wish me. Okay. So helping client, identify these kind of thought errors and replacing it is very, very important. Okay, my presentation is stuck. All right. Like I said, let's detect, dispute, discard unhelpful negative thoughts and replace them. Detect like a detective. Dispute, is it helping me? Discard the stubborn thoughts with flexible thoughts and replace them. Because it is desirable, because I want a phone, an iPhone, does it mean my father should provide it to me? Is it logical that he should get what I want? Is it helpful? Is it helpful that if I keep holding on to this belief, where is this belief getting me? Where is the evidence? Where is the evidence that others must not criticize me? Where is the proof, that I should be good all the times? Which belief is true? Which belief is false? What is the consequence of holding the stubborn belief? What is the consequence of holding a flexible belief? Do a check. Can you be happy with not getting what you want? Well, most of the time, yes, I can be happy with I can be happy if I don't get what I want. Is it logical to say that just because right now, COVID is there, life is uncertain, therefore world is a bad place? Not really, right? There are still good things happening in life. We are still, not looking at other dangers in life because COVID right now has colored our perception. We are not looking at other dangers. How does it follow logically when you say, I will not be able to stand this pain of getting up in the morning? I cannot take this pain of making my resume. Does it really, if you keep telling yourself, I can't take it, I can't take it, I can't take it, will you ever achieve your goals? Dispute with yourself, not with others and not with situations. This is the kind of REBT work that we do in a counseling setup when a client is, anxious, depressed, or angry. Yes, like Dr. J briefed us, we take detailed case history session, we monitor for suicidal thoughts, we contact the psychiatrist, check the diagnosis, the medicines that he or she is taking. We do a psychological test to find out whether it's mild, moderate, severe depression. We check whether it is we check whether it is severe, which kind of symptoms we want to work on first, the guilt or the shame or the suicidal thoughts. There's a teamwork between the client and the therapist that is setting goals, easier goals first, checking the motivation. Has the client come to you because he was forced by family members or the psychiatrist, or has the client come to you because he wants to get better? Does he have insights, or he just keeps blaming his family members and world for his problems? There is a lot of homework assignments that are given in between the therapy sessions. That is keeping a mood journal, a trigger journal, a feeling journal, the worksheets that you all just saw, the format of the worksheets. The client is given, is told to monitor a schedule, put a schedule, that is free time monitoring first, that is lazing a lot on the bed, cut on that time. Sleep schedule, maintaining a sleep schedule is very important. Gadget hygiene, reducing your gadget hours, breaking inertia. Depressed people find it very difficult. There's constant fatigue that they feel. There's constant, physical fatigue that they feel. So the first one is disputing these thoughts, these automatic thoughts that, oh, I can't get up from the bed. Oh, I can't take this pain of getting up from my bed. So disputing these thoughts that maintain these depression. Another one is, so like we just saw, we're going to work a lot on self-blame. That is, just because I did something bad, does it mean I'm a bad person? Just because I lost my job, does it mean I will always be a failure? Disputing such thoughts. Okay, I used to hit my child a lot. Can I not forgive myself? Am I allowed to make mistakes? I did something bad. Means I am bad? No. Can you forever do good all the time? Can you forever be good? You are both combination of strength and weaknesses, right? So our goal is increasing our strengths and reducing our weaknesses, but some weaknesses will always remain. And the client, should be allowed to make mistakes. He should tell himself that it's okay to make mistakes, that I can forgive myself. Counting blessings, increasing their pleasurable activities. Okay, when I was cleaning the room, how did I feel? Did I feel I was did I enjoy? How much was the pleasurable principle? Did I enjoy on a scale of 10? No. Cleaning, it was very boring. 3. How much was my achievement score? Oh, well, 7 on 10. I did something that I was avoiding. So increasing, achievement score or pleasurable score, helping them do simple guided meditation in this session, helping them with the apps that they can do, some simple stretches that they can learn from their physiotherapist, or yoga therapist, spending time in nature, exercising, moving your body a little bit, can definitely change the way you feel. Self-acceptance that, okay, I am depressed, just like I can get thyroid, just like I can get, I can have heart issues. Just like that, my mind is struggling with negative emotions, and but I still accept myself, that I still love myself, even though I have these negative emotions. And then, of course, shame attack, and we look at pros and cons. Same thing with anxiety. We change the self talk that just because something unpleasant is going to happen, it may happen, does not mean there is a guarantee that it will happen. Okay, that we help the client see that there is a may, and you have to keep sticking to the may and not jump to the conclusion that there is a guarantee. And check for the evidence that why my flight will not crash, and check for the evidence why my flight will crash, and make both the thoughts dispute with each other. Set aside worry time, get family support, share your feelings. The first thing is family members should be able to listen to their problems without judging them, show a lot of warmth and compassion, not judge them for having these negative feelings. Family members should be the first one to teach mental health, that it's okay to feel depressed, that it is okay to feel anxious, it is okay, it's all right, you can share your feelings with me. And of course, gather social support. So yes, if you have any questions, we can take them now. Thank you for watching. I hope the session was useful. And thank you for staying with us.
Thank you, Tanvi, for a very nice session. I would like to call Dr. Rashmi Pawar to introduce our state coordinator, Dr. Smaranika Das. Thank you.
Good morning, everyone. Dr. Smaranika Das is the founder and co-director of Kuramos Physiotherapy Clinic, a multidisciplinary healthcare and wellness initiative backed by the latest digital technology, and also holds the position of Goa State Coordinator for the IIPWC, wherein she, along with the state team, has been instrumental in organizing regular CMEs across the state for the benefit of the patients. She has completed her master's in physiotherapy from Rajiv Gandhi University of Health Sciences and is a certified orthopedic manual therapist recognized by McConnell Institute, Australia. Dr. Smaranika has mastered the art of providing a specialized regime for the marathon runners. She is a strong believer of holistic approach to rehabilitation. Thus, it comes natural to her that the diagnosis should be based on both intrinsic and extrinsic factors. Hence, Kuramos provides the patient specific treatment regime, which involves a holistic approach of physical exercises and a lifestyle management. Over to you, Dr. Smaranika.
So, good afternoon, everybody. I want to just understand, is my screen share visible?
Yes, doctor. Please continue.
Okay. All right. So today we are going to be speaking about physiotherapy in mental health. Quite unconventional because unfortunately, we don't see much of it happening in our clinical setups. But today, what I wanted to put forward is this is our tribute to the World Mental Health Day, and this is the Mental Health Awareness Month. So I thought we should put forward our aspect of how we can help in elevating the mental health also. So To start with, we are basically going to be talking about exercising in mental health. How exercising can help in making the mental health issues better. So, what does exercise do? We all know that it gives us physical health, isn't it? But not only physical health. Exercise not only changes your body, doesn't change only your strength, endurance, but also your mind. It also changes your attitude. It makes your attitude more positive and it elevates your mood. Now, whatever I'm telling is all based on scientific evidences, and that's what we are coming to, and how we can help, and what are the exercise prescriptions for mental health. So, nowadays, specifically after the pandemic has hit us, mental health has become a topic of growing interest, whether it is, in our platform that is World Physiotherapy, or you go to WHO, everybody is concerned because we are social beings. So, if we are into one particular area, not talking to anybody, and with the scenario that it is right now, it can be very taxing for anybody. Okay, so various mental health organizations work on prevention, treatment, and rehabilitation, and we can actually be adjunct in every phase of it. So it is a multidisciplinary approach, and here physical therapy can give a very important role into making the patient better. So, physiotherapy is basically a recognized conventional profession with healthcare that can offer extensive range of physical approaches. Now, what can be those approaches? We can start with physical activity, exercise, movement, even range of motion exercises help a lot. Relaxation techniques, body and movement awareness, more to do with posture, because that is also impacted a lot in the mental health conditions where you want to go into a comfortable posture, or a childlike posture, you feel depressed, so this is what you first do. So these approaches are basically aimed at symptom relief and the enhancement of self confidence and improvement in quality of life. Now, how does that happen? See, because many a times it is the physical ailment, if it is a chronic physical ailment, that can also be the cause of depression. Or if you perform an activity and it gives you pain, that can make you anxious, for example bending forward in case of a disc herniation case, or if it is a stroke case. So I would come to that, how those conditions can give you problem. So invariably, if physical therapy is able to help you come out of the problem or relieve the symptoms, it is going to help you in the mental health also. So we offer a rich variety of observational as well as education evaluational tools. So not only for the assessment part in terms of questionnaires or surveys, but also there are a range of interventions that can be done. And all of these are evidence-based literature with 50 years plus. So it is there from a long time, but the usage unfortunately in India is pretty less. Like in NHS programs in UK, physical therapist is a part of the whole mental health. But here we see it very less. In a few setups it is there, but not on all setups. Physiotherapy in mental health can address human motion, the functional part of the human body, physical activity, and also exercises both in individual as well as group setups. I always suggest group setups because it gives you a chance for a social interaction, which is so much required. So, looking into this pandemic situation, I suggest if we can conduct some group classes of the same kind of patients, and then give them either 15 minutes like before or after the session to just talk to each other, because that is very very important. I think that's where we need to shift now with the online sessions, how we can give them 15 minutes of interaction followed by the classes, which can be there for balance, or it could be weight training, anything that our particular group requires. So this is a statistics that tells us, and we have probably seen this while treating patients also. So above all the patients that we see, especially osteoarthritis, chronic condition, so they are having so much pain, they are into one particular area, not able to move much, not able to interact because there are no physical activity, they are increasing weight. So body awareness, that also becomes a problem. They are not confident enough to move out. The waddling gait that they have, that makes them little bit awkward walking in between other people. So these all causes depression, which is around 20% of people suffering from osteoarthritis end up having depression. Stroke, this is maximally seen. I have rarely seen people who are excited after it. They are all depressed, but yes, there are people whom we encourage. We make sure that there are some counseling sessions given to them as well as to the family members, so that they come out of it and they try to fight the disease, rather than succumbing to it. So in that case, 33% of the stroke cases, I'm sure in India it is even higher, because the help is little less in India. The setup is not so, you will not find ramp everywhere, or people do not really are so much aware about how to. So many of them are not even aware that physical therapy helps. So that's where they can get into depression. Then frailty is something like, they have a fear of fall because their balance is low. So this is another condition where 38%, and majority of our geriatric population comes under this. So this is where it is so important to have physical activity into our whole regime. Now, little bit of technical things over here, but something that everybody can understand, because we wanted this webinar to be for the general population. So I won't use very tough terms here, but what does physical activity do actually? Okay, so first thing is, it decreases your depression and anxiety by elevation of mood. Now, how does that do? So whenever we are doing some physical activity, some neurotransmitters, some chemicals in our bodies are produced. So this is the endorphin. Endorphin is something that is the best kind of a painkiller. So you don't feel any pain. And this, since I work a lot with marathoners, we call it as a running high. So when they are running, they are so high, they don't feel any pain. So that it also causes euphoria. That is a false sensation of well-being. So you feel very good. There's a feel good factor. Till now I haven't seen anybody who says after exercising I felt bad. Everybody feels good only after exercise. So this is how I would like to put it. It also reduces cortisol, which is the cause of stress in our body. Okay, so this is how it is going to elevate the mood. Now coming to some happy hormones. So it releases happy hormones. What are these hormones? These are called as serotonin and dopamine. They are also going to help us in having a better sleep. So this happy hormones give us a feel good factor. They help us in sleep in two ways: by the help of the hormones, as well as because you have done some physical activity, you become tired, your muscles become tired, you can sleep. And nowadays not getting sleep is one of the major problems. Everybody is seeing their phone before they go to sleep, get up and see their phone. So how much outside influence is there? We don't get to spend time with ourselves. We are constantly on social media, trying to see what others are doing or trying to show what we are doing. So that is one kind of a pressure. So sleep is very, very important. I feel in a holistic aspect, it is not only exercise and good diet, but equally important is the amount of sleep that you take. That's very, very important. Then comes stimulation of nerve cells. So here, so we have like a whole brain. The front portion is very important for us, which is the prefrontal cortex. It is going to help us in getting attention, focus. Okay, and then these areas are known as temporal lobes. So temporal lobes basically store memories for us. So these are two important things. What is beneath the temporal lobe is a very beautiful structure called hippocampus. So it is so beautiful, it stores all your memory. But at the same time, these are also the areas which degenerate the fastest. So what happens when you do physical activity? Regeneration of neurons takes place into these areas which are highly risk for degeneration. Degeneration meaning what will happen? Dementia. Loss of memory happens. It starts very slow, like you don't remember where you kept your key or an important document, but then later you start losing the memory. Short term memory loss is seen where people cannot remember what they have eaten in the breakfast, but they can remember long. So these conditions like dementia and Alzheimer's are not preventable conditions, but we can definitely delay. That means we can increase their quality of life, and that's, I think, what a physiotherapist does essentially, makes your life much better. So this is how scientifically it is helping us in recovery from the mental health problem, in prevention. Basically, everybody should do it in prevention of it, so that no mental health issues come up, and how exercise can help you. It will help in physical as well as mental health. So it's a best deal. Now coming to reducing the anxiety and depression. So people might feel ki, okay, do I have to exercise? I don't have the time. And also I just want to show you an example with an experiment to tell you how beautifully it works with our body. Both anxiety and depression, what happens is the effect of it can be either acute or chronic, the exercise effect. So in acute, basically what is done is one experiment where some physical activity was given for some minutes of time, 20-25 minutes, and seen the action of it on the brain. So I would say it actually lights up the brain. So that's how beautifully it works, even with just one bout of exercise. Okay. So imagine you do it for a long term. Obviously, it is going to help you in a better sense. So this is basically the University of Illinois, where this particular experiment was done, wherein 20 students were taken and they were given, like, you have to peace out. You just have to sit quietly, do nothing, think whatever you want to, but sit quietly, no talking to each other. This is when we saw that how the brain activity is blue and green, silent and less active areas. The moment it was like that, after that they were asked to do a 20-minute workout, and after 20 minutes of walk they were again seeing what is the brain activity. So can you see those red and orange portions? They're basically highest activity areas. So this is how it works on the brain. It elevates the neuronal levels, and regeneration can start over a period of time when you do the exercise. So University of Vermont has done a study which shows that if you do a 20-minute workout, it is going to affect for the next 12 hours. You feel better for the next 12 hours. So this is how beautifully we have to design our program. So since we understood this particular thing, I'll tell you how I design my programs. Okay. So this is the CBT, or some people had asked about insomnia also. Yes, it does help in insomnia, but it is not going to happen in one day. You have to progressively do it, right? So what we do here is I'm going to start from the supportive educational techniques. So this is where, like, I would say that this is the first part, what we are doing, awareing people, making them aware that physically being fit or physically active is also fine, is going to help them coming out of the depression. So that education, how I told you scientifically what hormones and all, they just have to understand that they're going to feel better. Then we do cognitive restructuring. We try to find out what is the problem, what are they scared of. Sometimes they're scared of physical activity also. Somebody who's had a fall because of a balance problem is always scared to walk. So to understand their problem, then to challenge them little bit, like first start them on walking with your hand support, then with a walker, then with a stick. So things like that. So physical activity will improve. Cognitive functional training is also a part of it. I cannot go in depth of it because we have less time, but we'll definitely try to do another session for that. Then comes problem solving. So here both mental and physical exercises are given. Physical exercises in terms of challenging them physically, mental exercises in terms of puzzles and some sudoku kind of games. Then relaxation skills are very important for anxious patients, to get them to relax, to calm down, pace them out. Sometimes they are so anxious that they can do the activity, but out of the anxiety they are unable to. So pace it out or change the physical activity. For example, a person is scared to be on a cycle, ask them to walk, so you are changing the pace. Okay. And also dividing the activity and gradually increasing. For example, we understood that 20 minutes of the activity is going to give you a 12 hours relief. Now we have 24 hours in a day. So how do we divide it? Maybe we can do 10 minutes of a walk in the morning, 10 minutes afternoon before lunch, 10 minutes in the evening, 10 minutes in the night. Okay. So if you are with family, you can go with them for a walk where you're sharing your day, or you can just listen to 2 to 3 songs while you're walking. So that will be approximately 10 minutes, or just talk to family members while putting the earphones on your walk also. So it is that easy to start, and that's what we need to put. And then we need to ask them to self monitor and report it back. Have they done that 10 minutes or 4 times walk or not? If not, why? And then talk to them and again motivate them to do it, because motivation is very much an essential part of this particular process. And also biofeedback. This is where I said maintaining of a diary, writing what physical activity they have done, what activity they would like to do, what do they enjoy. So that is also very important. We can't push an activity which they don't like to do. Secondly, what is the progress? like how much they are able to do, how many minutes. Okay, they could not reach 10 minutes, not a problem. First day you did 3 minutes also, next day you tried 3 minutes 10 seconds. So give them goals that they can achieve by themselves, and they don't need anybody else's support. Otherwise they will always say dependent, or so and so person was not there so I didn't walk. So these are the ways, by biofeedback, by their own awareness of how they are sitting. Like in case of Parkinson's, I always ask them to keep a small mirror in front of them so they can check on their postures, whether it is like this, straight, correction. And I think posture is a problem eventually everywhere nowadays with the sitting. So it can be used like that. And finally, I want to come to the benefits of physical exercise for everybody. It's not only for mental health, somebody who's suffering from a disorder, but somebody who's recovering, somebody who's suffering, and somebody who's not had it and want to prevent themselves from getting any problem. So it is basically in the nutshell, I'm going to talk about, see, physical activity is going to reduce your stress, increase the energy levels, reduce the depression, anxiety, have a better self-esteem, self-confidence, improved sleep is there, and increased confidence is there. So overall, it is going to increase your well-being. One factor which we have been speaking about is chronic illnesses, geriatric population, but now we can see a lot of stress in the working population. So for them, it is fine. But what we are missing out right now is for children and teenagers. We have to understand that the pandemic has got us into a situation wherein they are not going to school, they are not meeting their friends. It won't be wrong if I say that they have lost 1 year of their childhood. So in this scenario, I would suggest that physical activity should be given to them. Also, in terms of small games can be given. In the YouTube, there are so many games you can give them to children. Don't only give them like a story, like a audiobook or something, but more than that. So you can have the small games that are physical in nature, or ask them to do skipping exercise. Or if they have a cycle and your colony is allowing the cycling for the kids, then they can go for that. It gives the child also a very positive view about themselves, thinks that they are in control of their own exercise. Decision making becomes better, attention focus becomes better. So I think the whole self esteem of a child is going to go high if we do that. And with that, I just want to also tell that some underrated benefits of your exercise, along with the stress and anxiety, are sleep, higher esteem, confidence, and good amount of energy levels. So why not? I think this is compelling enough for you to start some physical activity, so that the mental health is also taken care of. Obviously, we have a lot of people who are suffering from it, and they do need expert advice, and that's why we thought that we would get a psychiatrist, a psychologist, as to how they can help. And then we can be an adjunct into this whole activity. Somebody who's suffering from the problem, this physical activity works as a very good distraction also for that duration of time. So I think overall it is going to help everybody with the amount of physical activities. Lastly, I just want to tell how much physical activity to be done. So researchers say that 30 to 60 minutes of physical activity is very good, and it is having good results for the mental health as well as for physical health. But anything more than 3 hours is too much. So that's where we have to understand, and we have to restrict. So for geriatric population, just like you're dividing the 60 minutes into 4 times or 5 times, you do it slowly, slowly to increase the time. In an adult population, we have to divide the whole time. For example, they can work out for 2 hours, we make it 1 hour in the morning and 1 hour in the evening. And what kind of exercises also, I'll give you a very short idea on that. So when the kids are concerned, try to make them more into a game, a play kind of a thing if it is possible, or skipping kind of an activity, cycling, at least 1 hour. When it comes to the team, they want to be with their peer pressure. So because of that, you can give them some sport activity in the school and all. But generally walking is something which can be given to them. Walking, dancing are some activities which they like to do. So in the teenage also, it is going to be 1 hour. Now coming to adults. So once you're crossing your 30s, muscle starts to reduce. So that's where you need to start doing some amount of weight training also. Minimum duration is half an hour for 5 days, okay? But it is same as that of the seniors, but the activities are different. For example, in adults, I would prefer 3 days of weight training and 5 days of cardio. Now they can divide the time accordingly. that they get minimum 30 minutes, but they can go up till 45 minutes to 1 hour. When it comes to senior citizens, then we have to look at their balance, which is the most important thing. So we have to give them balance trainings. Then there we have NIA techniques, that is low impact aerobics. We can give them water exercises. We can give them very simple walking exercises, like walking a dog also will help. So these kind of activities, again, 30 minutes, 5 times a day, but concentrate more on the cardio here than on weight training. But in the cardio, we like to improve on the weight bearing exercise, because osteoporosis is a bigger problem here. So more of weight bearing exercises like squatting. But if they can't squat, give them a chair, ask them to sit and get up. So it is as simple. The simplest activity you can give is supported squats with a chair. So this is something which we can do when we are activating ourselves on the um, laptop and all. Sit, stand, sit, stand. So that will also help a lot. So with this, I would like to finish my talk over here, and I would like to thank everybody who joined us over here. We are open for Q&A now, so any questions you can put, we will take it. And the previous questions would be also taken up by Dr. Riddhi and Dr. Rashmi. Thank you very much.
Thank you, Dr. Manna. Okay, so I would like to put up some questions, Ajay. Okay. Doctor, could you please give us or discuss regarding the serotonin, SSRI, benzoses, and technical things?
Okay. Hi. Am I audible, Riddhi?
Audible but not visible.
Okay.
Yes, doctor.
I think I got suddenly disconnected. Just a second. Okay. Hmm. All right. So see, basically, okay. Basically, what happens is that you tend to have chemical imbalances at the neuronal level, and when that happens, we have a few neurochemicals which are coming into play. So primarily, the ones which have been recognized for a very long time and in predominance are serotonin, norepinephrine, and dopamine. So the interplay of these three neurochemicals leads to at least the problems as far as the depression is concerned. In case of anxiety, we also have GABA, which plays a role, plus NMDA, which are the other neurochemicals or transmitters which are playing a role. And the basic understanding is that there is deficiency in the release of those neurochemicals. And that's why the medicines that we give helps neurochemicals to be produced in more amount, or even if even if they are not produced in more amount, you are able to uptake whatever the neurochemicals are uh, really. So, just to give you an example, most commonly used antidepressant medications nowadays is of a class SSRI, which is selective serotonin reuptake inhibitors. So, what it does is that it allows more amount of serotonin to remain in the synaptic cleft, what I just showed you in one of the slides, so that the availability of serotonin is more and the brain dysfunction or imbalance does not happen. So that's in nutshell. But then it's basically the interplay of these three neurotransmitters, that is dopamine, norepinephrine, and serotonin, which comes into play, and imbalances at that level. Obviously, individually, all those three neurochemicals have certain functions, like dopamine is more for pleasure, interest, serotonin is more for focus, concentration, and norepinephrine is also helping us in memory and other cognitive functions. So they have their individualistic role, but also interplay helps us in carrying out certain activities. So that's how primarily it happens. And uh, I hope I have answered that particular part of question. But the basic remains the same. It's the imbalance at the synaptic level which causes the disturbance as far as mood is concerned. And we have gone a long way from that basic neurochemical or neurotransmitter theory. As I've showed that particular slide, we are going into more deeper neuroimaging techniques. And we have also seen that many of these medications are also neuroprotective.
So if installed in the right at the right time and given for the right duration, it helps us to recover the neurons which are undergoing those kind of imbalances and changes. So that's something which is very important and basic as far as the neurotransmitter or the technicality is concerned. I hope I've answered this question the person who has asked it.
Yes, doctor. Okay. So, doctor, the next question is, okay, um, if a pregnant woman is having depression, will her child also experience depression in his or her life in future? If yes, what will be the cure?
No, so there are we have not reached that stage where we are 100% sure that if a person if a lady is developing uh, depression during pregnancy or in lifetime, will end up with a child end up having depression. So obviously we know that there are a lot of genetic factors which plays a role, but we have not been able to recognize that particular gene. I'm sure a lot of you physiotherapists must be also involved in the neurodevelopmental area, and you know that trisomy 21, Down syndrome, trisomy 21, and that kind of accuracy we have still not reached for any of the mental health issues. We are getting more and more information and more feedback, but at least for depression there is no single gene which has been identified. But what is more important is the environment that we create. So, and that's something which is easily modifiable, changeable, and that's where what Tanvi talked about is changing the beliefs, changing our thought process, and creating the positive environment. So even if you have a history of depression and if you get yourself treated and create that positive environment, the chances are that your child might not develop depression. So it's not necessary that whether it is a peripartum or postpartum depression and affecting the mental health, it's in general. And we have seen cases where both the parents have a mental illness of some kinds, whether it is mood disorder, anxiety disorder, but the children do not end up developing any of those mental health issues. But at the same time, no problems in the parents, but the child has. So that link is not very clearly established. But if somebody is coming to me as a client and asking me if I'm a patient of depression, whether I should get pregnant and whether my child will also suffer from the disease, then I definitely tell them that if you are ready mentally, if you are ready financially, socially for that change, don't worry about the depression, and you can go ahead with starting the pregnancy. I hope I've answered that particular question. Hello.
Yes. Thank you, doctor. Okay. Yeah. So the next question is, do the medications like benzos and antidepressants and sleeping pills like etizola cause nerve damage? And how to get de-addicted?
Okay, so I've read that question in the chat box, Riddhi, and thanks for asking it. And this is, I think, one perception which needs to change a lot. And why I'm saying it, because yes, most of these treatments, they are not short-term treatments, because the problems do not develop overnight. They gradually increase and come to a particular level where we start seeking treatment. And obviously, with the factors that I've discussed during my presentation, there is a very strong delay or lag which happens. And by the time, I'm sure neurochemically, biologically, there are a lot of changes which happens in the brain. Uh, if I have to talk about medications and their fate as far as the treatment is concerned or outcome is concerned, what we see is almost 80 to 85% of the patients are able to recover wonderfully well if they are able to follow the protocol and also are able to stop the medication. But still, there is a percentage of around 10 to 15% where the continuation of medications gives us the result, and a very small percent of 1 or 2 where in spite of being on medications you might still keep on having certain problems, but majority of them, they do have reasonably good recovery, which is not not like having issues of relapses or problems coming back. They are definitely not addictive. Well, obviously, when you are under supervision, when you are following what your doctors are telling you, it does not cause any addictions. But what typically happens is that we might have to continue certain medications for long duration and even for lifelong, primarily to maintain a particular level of improvement. Because whenever we try to reduce or stop the medication, the problem again reappears. So that challenge does remain in a very small percentage of patients, but then that definitely does not qualify them as an addictive medications, because just because they are working at brain, because we never talk about our anti-diabetics to be an addictive or our anti-hypertensives to be an addictive, because we just keep on taking them throughout our life. We don't even question whether they should be stopped. We know that heart is important. We know that pancreas is important, sugar control is important. So like that, brain is also equally important, mental health is also equally important. But if you follow what your therapist or clinician is doing, then definitely there is no question about it being addiction. It is just the treatment. The only catch here is, only difference is in some percentage we are able to stop and withdraw the medication. In certain persons we might have to continue just to maintain that good health. And even if we have to continue, we have to also look out for side effects and the long-term effects of the medications. That's why the regular follow-ups is very, very important. The one of the major concerns which the benzodiazepine, the group which was mentioned in the chat, is about the memory and the imbalances which can happen. And if we are seeing those kind of changes, then it is always advisable to change the group to something different, which are, we have different medications available which are non-benzodiazepine, the sleep inducers. So there are a lot of options available. You need to discuss with the therapist and try to get your decisions right. But definitely they are not addictive. I don't think so addiction happens if you are following what your doctors are telling you.
Thank you,
Yeah.
Dr. Jai. Dr. Rashmi Plava.
Yes. Thank you. Next question is for Dr. Tanvi. So, Dr. Tanvi, can you please share some information regarding OCD and CBT, and if CBT can work for insomnia?
Yes, CBT can work for insomnia. Initially, we have to do screening with the psychiatrist in terms of, medications and how long is the insomnia and history of it, whether it was recent or is the person going through something. So yes, medical evaluation, whether insomnia is because of anxiety or depression or a recent adverse event. CBT can also help with insomnia. That is, we can start working on what keeps the client awake at night. What are some of the worries, that is making him or her anxious at night. So start working on those automatic thoughts. Second would be helping them make behavioral changes. That is trying to sleep on time, getting into sleep hygiene, following a routine. Those would be behavioral strategies to work at. And working on worrying and anxiety would be another feature in managing insomnia.
Thank you.
Helping the client deal with the automatic thoughts that keep them at night.
Right. Thank you, Dr. Tanvi.
I'm sorry, I missed something about OCD. What was about OCD?
Basically, if anything more that you'd like to put about OCD, any more
Okay. Any more
information?
Okay.
OCD.
So OCD is obsessive compulsive disorder, which is also comes under anxiety disorder, where a person has repeated obsessions. Okay, sometimes these repeated obsessions could be very, very intrusive. They create a lot of disturbance in the client. They could be repeated thoughts that there are germs on my table, there are germs on the table. Second, could also lead to compulsions. That is, I would want to clean it. I would have this strong urge to keep cleaning it. Another kind of OCD could be that where a person only has obsessions but does not have compulsions. Okay, and OCD can also be treated with medications and with CBT, where the solution is on tolerating these obsessions, increasing tolerance to these obsessions would be one of the key feature of managing OCD, and delaying urges of compulsion will be the second goal in treating OCD.
Thank you, Dr. Tanvi. I'd like to mention that we are a little short of time. So any other questions that are there will be answered by the speaker on YouTube. Now over to Dr. Lavi. She'll be addressing the vote of thanks.
Am I audible?
Yes, Dr. Lavi.
Yes.
Yes. Good afternoon, one and all. I, Dr. Lavi Jain, State Sub-Coordinator from IFP Women's State Goa State team, would like to thank this opportunity to thank Dr. Jai Shastri sir, Tanvi Tanna ma'am, and Dr. Smaranika Das ma'am for giving valuable talks to our IAPWC Goa branch on depression and anxiety. We are obliged to have you with us for taking out your time and giving us such a wonderful presentation through this webinar. I would like to thank all the delegates for making this webinar a successful event. Last but not least, I would like to thank the whole team of IAPWC for organizing this event. Last but not least, I thank the IAP technical team for the support, Dr. Pooja Kamble ma'am, Zonal Head Base Zone for her constant guidance, and Dr. Sanjeev Jha sir, President IAP, and Dr. Ruchi Vaishnav ma'am, National Head IAPWC, for proving us with this virtual platform to reach out to the entire physiotherapy community. Regards, IAPWC team Goa. Thank you so much.
All right. And we are signing off.
Unmute yourself, Dr. Rashmi, unmute yourself.